أهلا بكم في تغطية حصرية جديدة من تلفزيون اليوم السابع. قبل أيام توصل علماء أمريكيين لطريقة مبتكرة بتتيح إنتاج أنسجة العين باستخدام الخلايا الجذعية والطباعة ثلاثية الأبعاد في سابقة علمية كبيرة نجاحها هيتيح علاج مجموعة من أمراض العين التنكسية في المستقبل. نجح فريق من الباحثين في المعهد الوطني الأمريكي للعيون بطباعة مجموعة من الخلايا اللي بتشكل الحاجز الدموي الخارجي لشبكية العين واللي بتدعم مستقبلات الشبكية الضوئية المستشعرة للضوء. وطبعا هتوفر هذه التقنية إمداد من الأنسجة لمن يعانوا من أمراض الشبكية التنكسية. الحقيقة إن زميلنا رامي نوار كعادته في الانفرادات والحصريات عايز أوجه له التحية الحقيقة على مجهوده وسعيه للحصول على اللقاء ده. بدأ رحلة البحث والتواصل مع دكتور كابيل بهارتي رئيس قسم أبحاث خلايا العين والخلايا الجذعية بالمعهد الوطني الأمريكي للعيون علشان ننفرد بتفاصيل الطريقة العلمية الجديدة. احنا من هنا تلفزيون اليوم السابع ننفرد بالظهور الأول في وسائل الإعلام العربية والمصرية للدكتور كابيل بهارتي رئيس قسم أبحاث الخلايا العينية والجذعية بالمعهد الوطني الأمريكي للعيون. Dr. Bharti, welcome on Yom 7 TV and thank you for being with us.
It's my pleasure. Thank you for inviting me.
Thank you. First of all, Dr. Bharti, when did you start working on this technology or development?
About 6 years ago. So we started with the idea that we can bioprint an eye tissue and make capillaries and blood vessels with it. So it took almost 6 years.
Mm-hmm. Could you tell us more about this development, Doctor? And could you simply explain to people how does it work?
Yes. Mm-hmm. So if you know the eye, the blood circulation from the body comes to the back of the eye, mm-hmm. and there's a tissue called the retinal pigment epithelium, in short RPE, and that tissue sits next to the blood supply, mm-hmm. and all the nutrients to the eye come through the RPE into the eye, mm-hmm. and we wanted to recreate the tissue, that RPE and the blood supply together, mm-hmm. because in this tissue, not only that it's important for bringing nutrients to the eye, this tissue dies in many degenerative eye diseases. For instance, in a disease called age-related macular degeneration, AMD, that affects many people worldwide. And we want to study how this tissue is formed, how this tissue functions, and how this tissue degenerates in a disease setting. Mm-hmm. So now we could make the retinal pigment epithelium using patient stem cells, but we could not make the blood capillaries, blood vessels in the back of the eye that are located in the back of the eye. So we decided to use bioprinting approach, where we can put together the cells that make the blood vessels, the endothelial cells, the pericytes, and the fibroblasts. These are the three cell types that make the blood vessels. We put them together in a hydrogel, we make a bioink, and we print it in the pattern that we want the blood vessels to form. Mm-hmm. And the cells come together and they start to make capillaries within 3 to 5 days. Mm-hmm. And as the two tissues interact with time, it becomes a mature tissue that looks like what we see in the back of the eye. It really functions like what we see in the back of the eye.
Mm-hmm. Great. So does this technology help doctors to work in different or more effective ways?
Yes, the most effective use of this technology is that now, once we understood that the two tissues are working together, mm-hmm. we were also able to recreate disease in this tissue. Mm-hmm. The disease that I mentioned earlier, AMD, age-related macular degeneration, we could cause stress on the RPE and then cause the capillaries to degenerate. Mm-hmm. Or we could cause hypoxia on the RPE and cause the capillaries to hyperproliferate and penetrate through the RPE, how it happens in the eye, and patients go blind. So now both of these diseases, which lead to blindness, we're able to study them in a dish, mm-hmm. and we're able to discover drugs that we can then bring to patients mm-hmm. as better treatments than we currently have for these two diseases.
So, Doctor, could you explain from which diseases exactly does this technology protect or treat?
So one of the main diseases is called age-related macular degeneration, mm-hmm. AMD. In this disease, the capillaries that are in the back, they die off, or they hyperproliferate, they start growing too much, and they go into the eye. And in both of these cases, patients go blind. There are many similar forms of this disease that happen early onset as well. Mm-hmm. One is called choroideremia, one is called sorbus fundus dystrophy. There are many diseases where these two tissues are affected. And we're able to now use this technology, study all those diseases in a dish, because remember, we can also make these tissues from patients on stem cells. This will help us make better treatments, discover better drugs, and perhaps also discover gene therapy for these diseases and test them in a dish before we bring them to patients.
Great. Is it still in the experimental stage, or has it already started to work on patients?
So the technology is working in the lab, and we use it to test drugs. We're now using it to test gene therapy, and we're bringing those drugs and gene therapy to patients. One of those drugs will be tested in patients hopefully by the end of this year.
When will it be officially available to patients in hospitals or clinics from your point of view?
So as a drug that are discovered on this tissue, hopefully within the next 3 to 4 years, we can bring those drugs to patients.
Doctor, next 2 years?
3 to 5 years, yes.
3 to 5 years, okay.
Yes. But we're also developing this tissue as a transplant to treat patients with late-stage degeneration. That will take much longer to bring, but we are still working on it.
So do you think that this technology still needs to be developed more, or is it ready to work?
Well, as a tissue in the lab for testing drugs and other technologies like gene therapy and antibodies, it's ready to do that, and we are routinely using it in the lab for that purpose. But as a tissue for transplantation in patients, it needs more work, and we are continuing that process to develop it as a tissue for transplantation.
So, doctor, if I ask you to give tips or advices to protect our eyes from damage or harm, what would you say?
Eat healthy diet, don't smoke, and use antioxidants in your diet, do regular exercise. All the things that are good for our body are also good for our eyes.
Good for our body, so it will be good for our eye.
Yes.
So finally, doctor, what are your future plans that you are working on now, which I'm surely it will serve eye patients around the world?
So we are trying to develop this tissue from patients on stem cells. So we bring these tissue back to patient as a transplant. We already have an ongoing clinical trial where part of this tissue is being tested in patients using patient on stem cells. And we hope to continue developing that technology so that we can bring it as a regular practice for treatment when patients' eyes degenerate. Rather than giving them a drug or a gene therapy, we can just replace the degenerated part with this tissue that we have developed in a dish. So that's what we continue to work on, and we hope to bring that to patients very soon.
Dr. Kapil, thank you for your time. Dr. Kapil Bharti, we are glad you're with us, and thank you very much.
My pleasure. Thank you for having me.
مرة تانية بنشكر دكتور كابيل بهارتي رئيس قسم أبحاث الخلايا العينية والجذعية بالمعهد الوطني الأمريكي للعيون، كان معنا في لقاء حصري على تلفزيون اليوم السابع. شكري أكيد لزميلي رامي نوار على جهده المعتاد عامة، وفي الحلقة دي بصفة خاصة تظهروا منه انفرادات أخرى كتير في الطريق لحضراتكم. بشكركم شكرا جزيلا على المتابعة. كنت معاكم أنا أحمد العدل، وإلى اللقاء.